Doctors of Reddit, what are the dead giveaway signs that someone is faking?
Whenever the symptoms aren't there when the patient doesn't know they're being watched. I had someone fake a stroke recently and walked in on her walking around her room independently after pretending to be limp on her left side, letting us take complete care of her and wiping her butt for her. It was wild. Yell.
My favorite thing about this thread is that half of the "here's how you know they're faking" comments get responses that are all, "yeah, about that. Let me tell you how that assumption fucked me over and I almost died. One time I was in hospital with decompression sickness and neurological damage and I couldn't piss. I told a nurse I needed a catheter, which she did right away, and I filled 3-liter bags straight off. Anyway, she commented that, if a man actually says he needs a long tube pushed up the hole in his penis, then you can be sure he needs it done.
Not a doctor but a paramedic. Tons of calls to the jail for inmates with seizures. I lift the arm over their face and let it go. They'll move it to prevent hitting their face, or I'll lightly brush their eyelashes and they'll twitch to it.
You can be faking good too. Had a tooth kicked out. Mouth filled with blood and swelling. I'd stuck a tissue in to try to stop the blood. I've presented to the triage at the dental hospital. I'm dribbling blood as I talk. She asks me if it hurts and I said, a little bit. She looked at me dead in the eye and said, one of the many things we triage on is pain. Gotcha. Good nurse. Hurts like a motherfucker. I've literally been kicked in the face. Thanks for that. Notes taken. Was patched up and out of there within an hour. Edit. Rip inbox. Lol. And thanks for the awards.
If someone is truly unconscious, their thumb always wiggle. Just say that out loud to yourself.
Nurse here, I had a teenager overdose on Zoloft and start having strange seizure-like episodes. What made them particularly strange is that they all followed a predictable pattern of onset. First, he would lower the bed, next he would turn the TV volume down, and finally he would check to see if I was nearby. There was pretty severe thrashing about without any abnormalities in breathing, heart rate, pupils, and he was still able to communicate with me throughout the entire episode. Unsurprisingly, EEG also failed to show any abnormalities. I have the reverse. My back went out, extreme sciatica pain, like being struck by lightning constantly. Couldn't move for days. When someone found me 3 days later they called 911. Just for the doctor to tell me I was faking it for pain meds. While I was crying in pain I asked him why I'd lay in a pile of my own piss and shit for 3 days for some Vicodin when I literally own a bar. Fucking insane. Edit. Thank each and every one of you for sharing your stories. As much as I hate hearing them, at least we aren't alone and we know what each other are going through at some level. Actually, I feel much less alone in the world right now, because I've never met someone in my situation before. But they are obviously out there.
My sister is a pediatric audiologist and this is my favorite story of hers. Apparently, sometime in elementary school, usually the early grades, a ton of kids like to fake hearing loss. Like not just, oh, I can't hear the teacher. Full on, want to get hearing aids, etc. Anyway, she explained to me that based on the way she plays the tones, you can usually tell if someone is faking. Especially when they just pretend they can't hear anything. But it's not 100%, obviously, because hearing loss patterns can be really weird. However, she's caught a number of kids simply by saying, okay, so I'm going to play a random number of tones and they'll go in both ears. I want you to say, yes, if you hear it, and no, if you don't.
Most often their story, description, exam doesn't make any sense. There are usually things that contradict each other. Abdominal pain is generally easy to tell when people are faking it. For example, I will press with my stethoscope instead of just listening. They don't respond to that pressure but will when I use my hands instead. Sometimes I'll ask them if they are experiencing a symptom that will rule out a diagnosis or make it less likely, and many times they think I'm asking it to support their supposed issue, so they will say they have it. Most of the time people aren't faking but just blow their symptoms out of proportion.
Still sometime in officially becoming a doctor, but have been taught what to watch out for. Doctor expects symptoms from you, not signs. People who Google diseases often tell signs that they shouldn't be aware of. Refusing blood work. Exaggerating your condition. Description not matching their history. Around public holidays, long weekends, suspicion is always increased.
When I had a stroke 10 months ago, my biggest fear was I was somehow faking it and the ambulance ride was a sham, and why was I doing it? No, it turns out I was having a stroke. I was so worried I was being a faker, although I have never done that before. Just a really odd mental state.
Obligatory, not a doctor, but I got a call from my son's school nurse when he was in second grade, and the conversation went like this. Nurse, sounding upbeat and cheerful, says, "Your son wants to tell you his terrible news." Son gets on the phone, says, "Hi mom, I cut my finger off." I ask him, "Where is your finger now?" "Son, I put it back on." I said, "Can I talk to the nurse?" Nurse gets on the phone again, says, "Sounds serious, right?" I asked, "Does he have a substitute teacher today?" "Ah, yes." I told the nurse to let him know I will take him to the hospital for a shot for his finger, to which he says, "I think it's okay." I glued it on really good. Nurse kept him in the office for a bit to talk about scary changes in the classroom. The inverse of this question. What can someone do if they are not faking it but for whatever reason they have multiple doctors insist they're faking it? But by never telling the patient they're faking it, nothing is ever resolved and it drags on for months and months.
Brief note for all the student doctors out there. People can pass stroke field tests and still be having a stroke. I could do everything on the list while I had a clot in my brain, verified by CT and MRI. Except I couldn't stop vomiting. Good times. Be aware sometimes shit doesn't look like you think it should.
Hey guys, just wanted to remind everyone to be careful here. Patients lie, that's true. But it's important to remember that in the US there's massive levels of discrimination and lowered standards of care for many patients due to staff's perception. Be very cautious. Thinking someone's faking when they're really not can lead to serious consequences for both staff and patients.
As a patient, it's apparently very sus if you say you don't want an oxyscript. I had some shit happen. Doc started filling one out for me, and I told him not to bother, since I wouldn't fill it. He got annoyed and said he wouldn't prescribe anything stronger. I got annoyed and said I didn't ask for anything stronger. For fucked reasons, oxy, hydro, codeine don't work for me. Advil literally does more for me than any of those, so I'll just take ibuprofen. But apparently the way I phrase that makes doctors think that I'm asking for better meds instead of explaining that I'm just not going to bother with the worthless ones that they default to.
I went to emergency once with intense chest pain. The young, new doctor I saw first listened to my chest and immediately concluded I had pericarditis, but the supervising doctor decided I was faking it for drugs for some reason. The next morning I woke up to a psychologist in my room asking all sorts of random shit when an orderly interrupted because the ultrasound guy was in and wanted to see me first thing, I think after talking to the first doc I saw. Turns out I had pericarditis and myocarditis, and the dude wheeled me out himself and told them order an ambulance to take me to a hospital with a cardiac clinic.
I had a 360 testicular torsion and a doc thought I just had some inflamed glands due to my reactions. Luckily I came back after they sent me home, or I would have lost my ball.
I just want to point out that there are many types of seizures and there's a bit of a stigma surrounding people having them. Some people have focal aware seizures and will be able to respond and control their limbs during the episode. It's dangerous to assume that someone is faking just because they aren't experiencing a seizure, like how you expect seizures to look.
I once had a patient with appendicitis. Every time I prodded him to check whether he actually had it or not, it would pain in different spots. Soon, it got to a point that wherever I prodded him, he screamed like a stuck pig. I mean, that's a dead giveaway sign that someone's a faker.
I'm reading through this and hoping my doctor doesn't think I'm crazy. I've been recovering from long-haul COVID and it makes it seem like I want meds, but in reality, I just want answers.
When their allergy list is 30 medications long and their reactions to said medications are things like total body numbness, or something that isn't mechanistically possible, and they come in with a painful syndrome that isn't mechanistically possible. They generally claim that their body is special, and that no scientific training we get applies to them. They also claim everyone is out to get them and like to tell me stories of previous doctors they hated, rather than helpful information. There are two reasons people do these things: secondary gain, requesting opiates for a high, or psychosomatic reasons. Stress causes a physical response rather than a pure mental one. The latter is real pain and not sinister in motive, just not organic pain that is a sign of true organ injury.
Not a doctor, but as someone with health anxiety, sometimes I cannot tell if I am actually experiencing pain, odd feelings, or if it's only in my head. Once my doctor accused me of faking to get out of school. I went in with serious stomach issues, and for some reason he decided to tickle me, which instinctually made me fidget and smile. To him that meant I was faking it, and he sent me away without checking my actual problem. I was grounded, and 15 years later, I still have those stomach issues. Fuck you, Dr. Goody. If you see them crawl through a vent, they're definitely an imposter. Vital signs. If you say you're in excruciating pain but your heart rate is 65, then I'm pressing X and doubting you. If you are short of breath, but you are breathing at 12 times a minute normal instead of fast, and your oxygen saturation is 100%, then the problem isn't in your lungs. Anxiety can present like this, which isn't faking it, but it requires seeing past what the patient is telling you. If you tell me you've been clean from meth for a month but your heart rate is 120, then I'd like you to pee in this cup.
A lot of doctors think someone is faking and refuse to treat them, and then later on the patient gets a second opinion and finds out they are seriously ill. My mom went to 3 doctors before anyone thought to give her a scan for her back pain. Turned out she had 20+ kidney stones. She went for surgery immediately. No. She was not faking. Not going to lie. On average, male doctors, sometimes white, but usually always male, will not believe female patients. We're taught to believe patients. Everyone has a different way of processing and expressing pain and illness. Women especially are underbelieved about symptoms.
Not in the medical field, but I've heard an old nurse's trick. If someone is pretending to be unconscious, then lightly brush your fingertips over their eyelashes. If their eyes flutter, they're faking it. Another for faking unconsciousness: lift their hand high above their face, and let go. If it does not hit their face, they're faking it.
I got accused of faking it for 6 months, went to multiple doctors about a chronic pain in my left ribs and numbness in my left arm. Turns out, I wasn't. After 5 months of trying, they finally decided to run more than the standard chest pain protocol tests. I had injured a nerve in my thoracic outlet. Point is, not all fakes are actually fake. Some doctors are just incompetent. Most if you live in Finland.
It's not fun when someone dies because an unskilled doctor is sure they're faking it because of some dead giveaway.
My wife is a nurse and used to work on an adult unit, now works in NICU. She said there used to be drug seekers that would come in stating they were in the worst pain they had ever felt and they needed pain meds for it, often asking for a specific drug. After leaving the room to talk with the doctor and getting the appropriate prescription filled, or denied, upon her return to the room to give the patient their drugs, she would often find the patient soundly sleeping in their bed. Someone who was in 10 out of 10 pain 15 minutes earlier is now just taking a nap. A lot of the doctors would tell her to just spill out the drugs, and give the patient some saline, then send them on their way. The opiate epidemic hit our part of the US pretty hard.
Last time I went to the hospital I was treated like shit and ignored the whole time despite being in the worst shape of my life, and got charged an arm and a leg for less treatment than I would have gotten laying in bed at home in terrible pain. So, thanks to this thread for reminding me how often medical professionals think people are faking and people like me get treated poorly as a result. Reminder of why I refuse to ever willingly go to the hospital for as long as I live.
You really should add a serious tag to a post like this.
It took 7 years for me to get a diagnosis. I think it was a mix of endlessly shady and crazy patients and doctors who thought they knew better. It was a nightmare.
I worked for a mental health after-hours phone line. We'd get calls ranging from lonely people wanting to talk to police officers requesting a counselor to come out with them to deliver terrible news after a car accident. One night I answered the phone and it was a woman saying, "I just swallowed 8 Tylenol extra strength and 3 razor blades, what you gonna do about it?" Like she was asking about the weather. I thought she was being too matter-of-fact to be entirely truthful, but maybe it was her resolve. Didn't matter. I just transferred her to crisis mobilization. Wasn't my job to judge.
I remember one time a person came in, they said they were having trouble breathing and could barely walk. I said okay, come walk with me and we will see what I can do. They started limping and putting on a whole scene. I said whoa, look at that thing, it was a bird in the building. They went wow and looked at it for about 10 seconds and I said oops, I've gone the wrong way, quickly let's go this way. They turned around and started walking absolutely perfect. They continued to walk for about 3 minutes to the other room and I said so what's the problem again, and they said the same thing and fuck. You see them the next day in a presidential motorcade.
Dr. Kelso said it best. Are you using any drugs? No. Never. Good. Because this pill would kill you if you did. Oh. Drugs. Yes, of course. Cocaine, heroin, cannabis.
I don't think it's as a very nice thread for patients to read. Functional disease can be fatal, same as psychosomatic pain is pain, and drug withdrawal is unpleasant. A lot of fakers need psychological attention, and as a doctor in ed I try to help them. It is important to know how to differentiate between the immediate harm risk, patients who are having prolonged seizures, and the non-epileptiform episodes, but going, nah, they faking. None of us on this thread are going to be mean to you, we will treat you. Hopefully the people here who are posting will also think about your ongoing care needs. I appreciate America has different pressures. I'm fortunate in the NHS I can refer on to specialist services without concern.
Not a doctor but shadowed a nurse at a school once and she told me that if someone coughs after every sentence they're faking it, or if someone has a sprained blank and the skin in the specified area isn't flushed then it's fake.
Doctors are the worst for assuming someone is faking. I went untreated with gallbladder issues for 2 years. I spent over 20 times in 1 year going to the for what I didn't know. They never told me, until later, was gallstones. I heard everything from lactose intolerance to an ulcer. Eventually they started treating me as a drug seeker because I was there so often. I would go 2 hours in excruciating pain before getting any kind of pain medication or seeing a doctor. It was the literal worst time of my life. Not everyone is faking their symptoms and you're not always smart enough to tell.
I want to know how you tell when someone is pretending to be a hypochondriac but they're actually faking it.
As a paramedic, I got on a call for a guy have undisclosed shoulder pain. I do an assessment, and he doesn't have any specific injuries but he keeps saying he broke it. I haven't offered him anything yet. Then he tells me, can you do 5 mg morphine every 5 minutes and we'll see if the pain is still there. And holds out his arm for me to get a line. Weird, his pain seemed to disappear the second I told him I'd rather start with slinging it and putting an ice pack on it.
As a therapist, a lot of the faking I see is with people faking strokes. I tell them to lift up a limb and those faking obviously say they can't. Then I'll ask them to do something functional like put on a sock and they'll do it no problem.
Not a doctor, but if someone walks in and tell me they've just severed their spinal cord, I'ma immediately have some doubts.
A teenager presented with hip pain, and had been through the emergency department previously. Their story did not add up at all, and neither did the pain presentation on assessment. As it was in a public health system, we were able to continue to see them to work through the concern. My colleague ended up having them in hydrotherapy where their painful side, limp switched from when they entered the pool to when they left.
Doc here. It's risky to assume there are dead giveaways, because all patients aren't going to follow the textbook. It does raise my suspicion if their pain doesn't go all the way to their eyes. That is, the facial expression of pain can be mimicked, but true pain causes agony that gives almost a 1,000-yard stare. Hard for me to describe, I know. It comes more from experience rather than ticking off boxes of pain measurement.
Parents, doctors. I constantly faked pain as a kid. They think I'm sick. Write me a note. Let me stay home and play video games. One day. I'm 14 years old. First day of school. Cow. No more faking stomach aches. Study hard. You'll have to apply to college soon. I think I might have genuinely Pikachu-faced.